So I guess the first question is, why would anybody really want to get a tummy tuck? Welcome back to the Aesthetic Minute. If this is your first time, I make videos about cosmetic surgery and stem cell treatments, and I try to make it as simple as possible for you to make a good cosmetic surgery or stem cell procedure decision. Just click the subscribe button and the bell, and you'll get notified anytime that I release a video. Now back to the video. Couldn't you just do it with a little bit of liposuction? Can you do a little bit of skin tightening to fix it? And the answer is yeah, most of the time you can, but sometimes, especially after pregnancy or if you've lost a lot of weight, let's say you've gone through weight loss surgery, usually get a little bit too much skin that hangs over. If you have a actual overhang that's maybe, let's say 2 inches, that's a good measurement in that front lower abdomen area. Once that happens, you can't really do anything to tighten the skin up. Our skin is really hard to tighten. You can tighten it if you heat it. Temperature is about 114 degrees. You can get it to contract. Think of a piece of bacon. The longer you cook it, the more shriveled up it gets. Human skin is actually no different than that in terms of how you tighten. But like I said, that's a totally different segment. Right now we're going to be talking about tummy tucks and why you should get it. So one of the first things you really have to realize is if you go into a plastic surgery office, most of the doctors are going to just be like, hey, what do you want? Tummy tuck? You're going to go in for a consultation and it's going to go a little bit like this. Hey doc, I've got a little bit of loose skin. Tummy tuck. I just had a kid and my tummy looks a little tummy tuck. My finger hurt. Tummy tuck. Sometimes I bend over and I have a little bit of a muffin top. It's going to be a tummy tuck. Now, why do they want you to do a tummy tuck so bad? And honestly, what I've really noticed a lot of doctors are doing is tummy tuck makes a crap load of money. It's an easy thing to sell because most people have tummy problems, but you don't actually need to do a tummy tuck procedure, at least nowadays, with all the technologies out there. Now, there are some patients that will, and we'll go over that in this series, but for now, I want you guys to realize that you've got a few options out there before you get cut on. Because once you get cut on, you can't ever get rid of that scar. The scar is pretty big, and you should do everything you can to avoid having to get cut on in the first place. So let's say you really did need a tummy tuck. What are the options out there? Well, you can do what's called a fully circumferential tummy tuck. That's if you've got an overhang that goes all the way around, including your love handles. Usually that's patients that have gone through weight loss surgery and have loose skin that goes all the way around their body. The other type, which is the majority, is somebody that's had pregnancy or a little bit of weight loss and you've got a little bit of an overhang in that front abdomen pooch area. That's kind of the area that we want to talk about because that's the kind of patient that's going to have the majority of the options out there for them. So if you fall into that category of a little bit of loose skin over the front abdomen, you've got a couple things to think about. One is, are we removing fat? Most likely, yes. So you need to look at some sort of liposuction as well. There's so many different kinds of liposuctions out there. We offer something called tickle liposuction, which is a gentle vibration-based lipo. It doesn't kill the fat cells, so you can always transfer it if you want to, which is the new rage. You can get a bigger butt, bigger breast, that kind of thing. But in general, it's safer, it's done while you're awake, and it's pretty quick. The second issue is you can always do smart lipo on top of it. Most doctors will do that nowadays because the smart lipo, which is also called laser liposuction, will tighten the skin really well. To tighten human skin, it's really not that difficult. As long as we can get to 114 degrees, you can get that collagen in your skin to contract down. And then what that does is your body then goes, whoa, 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 what did you just do? And your body goes into this healing mode and it starts to regrow collagen after we've heated it up. That takes about a month. And once that new collagen is grown, you can actually see that tightening effect even more for the next 6 months. The majority of you guys watching this, that's what you really need to be looking at. Some sort of liposuction with a smart lipo or a laser liposuction on top of it, and you'll be skinnier and you get the skin tightening effect. Those kind of procedures take maybe 90 minutes. They don't require any general anesthesia, so you can go in, you're totally awake for the procedure, and there's not a lot of downtime afterwards. Oh my gosh, it's so hot, I'm sweating out here. All right, guys, welcome back. We just got back to the office, but the very first thing that we really need to do is figure out why would someone need a tummy tuck. A lot of times after pregnancy or even weight loss, we get a little bit of an overhang in our lower abdomen pooch. If that overhang hangs over maybe 2 inches or more, then you probably need to do some sort of tummy tuck. Actually, the easiest way to describe this is, well, let's just go. Okay, so probably the easiest thing to do is to draw a little picture about this. So basically, if we have someone's abdomen and then you have the belly button, the first thing that we want to do is look at the waistline. So typically if someone has an overhang, it's gonna be something like this. And they're gonna have love handles. So the first thing you wanna do is you wanna go in here, you wanna take these love handles out. That's liposuction. Then you've got the belly button. If there is an overhang here, and if this is 2 inches or more, then we gotta do a tummy tuck. And in that case, when you do a tummy tuck, you actually make a little bitty incision. So you go all the way around the belly button, an incision this way, and then all of here. So all of this is gone. So then what you're left with is a skinnier waistline, and then we make a new belly button, but now you have a scar that goes all the way across. Still better than what it used to be, but you have to give it up for the little scar now. Much skinnier waistline. Does that make sense? So what I'm trying to say is, if you have a little bit of fat, then I'd say stay with liposuction. If you've got a little bit of an overhang, then I'd say go with a tummy tuck. But what kind of tummy tuck? That's gonna be kind of up to you. Most of the time I'd say go with an awake-based tummy tuck unless you have some abdominal muscle tightening that needs to be addressed. If that's the case, then I would say go with a traditional tummy tuck. They're gonna be able to tighten your muscles, which we won't be able to do with an awake-based tummy tuck. But if it's just fat and some loose skin, you can totally get away with what's called an Avillard technique tummy tuck or an awake-based tummy tuck. All right, so I hope that helps you figure out if you need liposuction or if you actually need a tummy tuck. Now, the next video that I'm gonna do is gonna talk about different alternatives to a tummy. Now, that also means the traditional tummy tuck, that means just skin tightening, that means just liposuction, both non-surgical and surgical. So if you're interested in that, watch the next video and I'll see you next time.